This is an exercise that every trainer, PT, and therapist should be using with their clients if you're trying to improve hip internal rotation. Hi, I'm Alex Effer, founder of Resilient Training and Rehab. I've helped thousands of coaches and therapists from around the world get faster and more consistent results with their clients. Let's get to it. So it's important to understand with this arm bar exercise that it's not only going to improve hip internal rotation, but it's also going to improve internal rotation throughout the entire side that you're rolling over top of. I like to use this with a lot of clients early on because what it does is it teaches them to go from their back, which is a little bit more of a relaxed state, and make it a little bit more dynamic to rolling on the side. A lot of times what people will do is they will stretch muscles in the back of their hip in order to restore the internal rotation. But what we are doing is we are using gravity. We're using the ground in order to create the shape that we're looking for to improve internal rotation. A lot of times, especially if we have people who have this pelvis that's a little bit more externally rotated like this, where all the structures in the back of the pelvis are a little bit more stiff, and maybe their pelvis is forward, it's important that what we're trying to accomplish is creating more space in the back of the pelvis, not by stretching, because that's just an acute way to improve it. It's not going to be a long-lasting thing. We are trying to create a shape of the pelvis that allows for that internal rotation, and most people can't create that shape themselves. So using constraints like the ground, especially in this arm bar exercise, is going to be very effective. Now, it's important when people do this to pick up on certain compensations to make sure that they're actually doing it the right way. And there's two main ones that I commonly see with this arm bar. The first one is that they overly rotate. And so when they do that, you see their heel come off the ground. So if I were to roll over my right side and we're looking at this right leg, when I roll over, you'll see this right heel pop up towards the ceiling. If that happens, they're just doing this rotation through their lower back. They're not actually getting that hip internal rotation. So it's important that when they do it, they don't lift the heel, but instead you want to only roll as far as you can where the outside part of your foot and your heel can stay on the ground. That is going to allow for the pelvis to roll on top and the hip to internally rotate. Just like I showed you with the pelvis, the ground is going to push up towards the ceiling. So if I'm doing this, my pelvis is rotating over, the force is going to push the femur into internal rotation and the tibia. But if my foot comes off, then my whole pelvis is just rolling, and I'm just going to be maintaining that externally rotated position. The second way people compensate is they will flare their ribs. They'll actually leave their shoulder behind as they're doing it instead of their shoulder and their leg rolling over at the same time. So their upper body and their lower body should be moving kind of together versus the lower body moving and the upper body staying behind. And so the ribs kind of flare in order to create that rotation. That's not going to effectively, again, improve the internal rotation on this side because it's just going to be coming through the TL junction, which is the lower part of your rib cage, or the lower back. And so what to look for when this happens is as they're rolling over, you kind of see their shoulder get left behind, and then their ribs kind of flare and their ribs are nice and open. But if you can see, my shoulder blade looks like it's retracting versus my shoulder being stacked as I'm rotating. So as I'm going, you're going to see this, again, the shoulder being retracted and the arm falling behind. So what I want you to think about doing is as you roll over, think like this leg is going to be pulled as if somebody's pulling this leg and you're reaching the arm towards the ceiling the whole time. If you do that as this leg comes over and you're reaching and your arm's reaching, you're going to get that rotation where the shoulder can stay stacked over top of the rib cage and the pelvis and the rib cage can move together versus the pelvis rotating and then the ribs flaring to finish that rotation. So one of the ways that I'm going to test and to make sure that this exercise is getting the results that I'm looking for is looking at a supine hip internal rotation. Now you could do this passively where you're actually doing it for your client, and that's really the way that I prefer, just so I can feel if the pelvis is rotating away from me or feel where that hard stop is. But you can also do it actively on yourself, where you're just bringing your leg up to 90 degrees and then you're turning the foot out. Now, when you're doing it, a couple things to look for is, as you're doing it, is that hip hiking up? Or as you're doing it, do you see the pelvis kind of rotating away from that side? Those are two ways that you can determine that that person is missing that hip internal rotation. And so when you do this exercise, we should see a restoring of that ability to internally rotate the hip without those compensations. So now, of course, when we are looking at doing these exercises, it's always important to pick things that are very individualized for your client. However, in my experience, this is an exercise that I commonly program, and it's exactly why I've added it into my free warm-up program, where I've basically just created 6 exercises that I commonly use that I feel like check off a lot of boxes for a lot of clients. So if you're looking to get a little bit more information on exercises like this to improve on yourself or to use to improve your overall mobility or the mobility of your clients, then check out my free warm-up program. The link is below, and I'll see you next time.